NVIDIA, a leader in semiconductors and artificial intelligence, is expanding its influence into the healthcare sector. CEO Jensen Huang emphasized the company's commitment to advancing healthcare through AI during the J.P. Morgan Healthcare Conference, envisioning a future where AI significantly enhances medical instruments and drug discovery processes. NVIDIA's venture into healthcare has been in progress for over 15 years, with the COVID-19 pandemic accelerating its integration into the sector. The pandemic highlighted the urgent need for digital transformation in healthcare, providing an opportunity for companies like NVIDIA to make significant contributions. NVIDIA collaborates with industry giants like Johnson & Johnson MedTech and Microsoft, with its clients spending over $1 billion annually on NVIDIA GPU computing. NVIDIA's recent partnership with Hippocratic AI focuses on developing generative AI healthcare agents. These agents, designed to independently interact with patients, aim to revolutionize healthcare by providing services ranging from pre-operative care to assisted living. The success of these AI agents hinges on their ability to emulate human interactions, a challenge NVIDIA addresses with its advanced technology. Kimberly Powell, NVIDIA's Vice President of Healthcare, noted that voice-based digital agents could significantly enhance healthcare if they can respond to patients as humans would. Hippocratic AI's rigorous testing has shown that minimizing latency is crucial, with NVIDIA's technology playing a vital role in achieving the necessary speed and fluidity for effective patient interactions. NVIDIA's strategy focuses on providing the computational power required for the growing AI healthcare ecosystem. By making its AI training and inference technology accessible, NVIDIA ensures its resilience and relevance regardless of which organizations lead the innovation. This strategic position allows NVIDIA to support and enhance the capabilities of healthcare providers, ultimately aiming to mitigate staffing shortages and improve patient outcomes. In other news, a recent study has demonstrated that a simple blood test can more accurately diagnose Alzheimer's disease than traditional exams, identifying the disease correctly about 90% of the time. This is a significant improvement compared to dementia specialists and primary care doctors who identified Alzheimer's correctly 73% and 61% of the time, respectively. The study, which involved 1,213 patients in Sweden, was published in JAMA and presented at the Alzheimer's Association International Conference. These promising findings are part of broader efforts to develop an inexpensive and straightforward blood test for diagnosing Alzheimer's, potentially replacing more costly and invasive methods like spinal taps. While some blood tests are already available in clinics, they are often not covered by insurance and can cost hundreds of dollars. The study involved patients with cognitive symptoms, with an average age of 74. Among the participants, 23% had subjective cognitive decline, 44% had mild cognitive impairment, and 33% had dementia. Researchers measured levels of p-tau, a protein that accumulates in the brains of Alzheimer's patients, and amyloid beta, another Alzheimer's biomarker. The blood test's superior diagnostic accuracy compared to clinical evaluations is attributed to its direct measurement of these biomarkers. Alternative diagnostic methods for Alzheimer's include PET scans, which can cost over $5,000 and are not typically covered by Medicare, and spinal taps, which are invasive. The new study suggests that diagnosing Alzheimer's could become quicker and easier, enabling patients and their families to better prepare for future medical needs, participate in clinical trials, and anticipate care requirements. Alzheimer's is the most prevalent form of dementia, affecting over 6 million Americans. Although it can occur in younger individuals, it primarily affects the elderly, with the number of cases doubling every 5 years after age 65. The Centers for Disease Control and Prevention projects that up to 40 million Americans could have Alzheimer's by 2060. The disease, which starts with mild memory loss and progresses to severe cognitive decline, is one of the leading causes of death in the United States. While there is no cure, existing medications can slow its progression. Next, vials used for blood culture samples are in critically low supply, creating significant challenges for patient care. The shortage of blood culture bottles, manufactured by Becton Dickinson, BD, could delay diagnoses, lead to misdiagnoses, or cause other complications if not properly managed, according to a recent alert from the Centers for Disease Control and Prevention, CDC. Blood cultures are essential for diagnosing patients with bloodstream infections or conditions like sepsis and endocarditis. Sepsis is a particularly severe condition affecting at least 1,000 million people in the US each year and being a leading cause of death in hospitals. About half of all laboratories in the country use a blood culture monitoring system that is only compatible with BD bottles, amplifying the impact of the shortage. The shortage has resulted from supply chain disruptions. BD has informed clinicians that more vials should become available by September. In the meantime, the CDC advises health facilities to enhance their blood culture collection practices to avoid unnecessary cultures, thus conserving the limited supply of bottles. And now, the interesting healthcare facts segment. Disparities in cardiovascular disease outcomes between urban and rural areas are growing, with nearly half of U.S. counties lacking a practicing cardiologist. According to a new analysis published in JCC, the flagship journal of the American College of Cardiology, these underserved counties are typically rural and socioeconomically disadvantaged, with a higher burden of cardiovascular disease, highlighting a significant geographic disparity in access to cardiovascular care. The analysis of 3,143 U.S. counties revealed that 1,454 counties, home to 22 million residents, had no cardiologists, while the remaining 1,669 counties each had an average of 24 cardiologists. It found that 86% of rural counties had no cardiologists, and residents in counties without cardiologists faced an average round-trip distance of 87.1 miles to reach the nearest cardiologist, compared to just 16.3 miles in counties with cardiologists. Counties without cardiologists also had a 30-watt higher cardiovascular risk index, a greater prevalence of all risk factors, higher age-adjusted cardiovascular mortality rates, and an average 1-year shorter life expectancy. These counties were more likely to be rural, have lower household incomes, higher uninsured rates, worse access to healthy food and primary care, and more preventable hospitalizations. Native Americans were the most likely to live in a county without a cardiologist. Additionally, counties without cardiologists were generally not on the U.S. coasts, with the South exhibiting the highest cardiovascular risk index. The study underscores the critical need to address these disparities to improve cardiovascular disease outcomes for Americans in rural and disadvantaged areas. Potential solutions include policy reforms, such as financial incentives for clinicians to practice in underserved areas, and better leveraging telemedicine. Enhancing the integration and coordination of cardiovascular care, particularly in prevention and risk modification with primary care, is essential. Broader policy interventions to widen broadband access, increase digital literacy, and improve health insurance coverage could also have a lasting impact. These measures aim to address modifiable risk factors and enhance overall health outcomes. And there you have it. Please subscribe to this channel